Salmonella food poisoning or salmonellosis. This is the most frequently occurring bacterial foodborne infection caused by the genus Salmonella and species typhi. Salmonella typhi consists of the bacilli, and these are responsible for the typhoid fever. The toxin secreted by Salmonella is termed as enterotoxin because it causes the gastroenteritis or the inflammation of the lining of intestinal tract. This enterotoxin causes gastroenteritis, sometimes septicemia, that is with or without focal suppression, and the carrier stage. Coming to the organism, these are gram-negative rods. This is the size, peritrichate flagella, non-spore forming, non-capsulated. If we go for the biochemical reactions, these are indole negative, MR positive, VP negative, citrate positive. They can ferment glucose with gas but do not ferment sucrose and lactose. They can grow wide range of temperature, pH and water activity, that is AW. But the optimum temperature is 37 degree and optimum pH range is 4.1 to 9.0. Now the source of infection. For the salmonellosis, there are different sources of infection. First is the raw meat, poultry and seafoods. So they can be contaminated during the harvesting from the contaminated water. This way, these are the very important source for the salmonellosis. Second is the raw eggs. Raw eggs also, they are used in many of the homemade mayonnaise and different sauces. But what happens if the egg shell, because it is a perfect barrier to contamination, but sometimes that can infect it. From the infected chickens, the egg will also be infected. So such type of eggs, if it is consumed raw in any of the food or if, like that only, so that can be a source of infection. Third is the fruits and vegetables. So during the mishandling of the food, that fruits and vegetables, these also become a source of infection. Then unhygienic practices, like if the unhygienic practices are there, like without washing hands after using toilet or after changing the diaper, or the pets or the reptiles, their excreta, their sheddings, these also are the source of the salmonella infection. Now coming to the pathogenesis. So as with other infectious disease, this general morbidity is very low, but it could convert into a high any of the outbreak also. Now, incubation is 12 to 36 hours. Sometimes the incubation could be shorter, 5 hours, or it could be longer, like 72 hours. But generally, it is 12 to 36 hours. The symptoms which are included here are nausea, vomiting, abdominal pain, and diarrhea. Now, sometimes the symptoms could be watery, greenish, foul-smelling stools, prostration, muscular weakness, faintness, moderate fever, restlessness, twitching, and drowsiness. Mortality is very less. It is less than 1%. Now coming to the severity and duration. It is also dependent on the amount of food food that has been consumed. Like if the high amount of food with the bacteria or the toxin has been taken, so the chances will be, and the duration and the severity will be more. So usually the symptom persists for 2 to 3 days, followed by uncomplicated recovery, but may linger for weeks or months. Now 0.2 to 5% may become the carrier for the salmonella infection. Here you can see the symptoms, and these are the different symptoms are shown here. Now complications. Sometimes the person or people with the, like especially infants, young children, older adult, transplant recipients, pregnant women, and people with the weakened immune system. So they could develop the complications. Okay, generally the disease salmonellosis get recovered within the 3 to 5 days, but sometimes the person with the low immunity, weakened immune system, they can get the infection complicated. So what happens during this time? The dehydration is the first symptom. Second is the bacteremia. Third is the reactive arthritis. So here the dehydration warning sign includes decreased urine output, dry mouth and tongue, sunken eyes, reduced production of the tears. Now bacteria, what happens in the bacteremia? The bloodstream, it can infect different tissues throughout your body. So different tissues included are meningitis, that is the surrounding the brain, then heart, so that will result in endocarditis, then bone, that can result into the osteomyelitis, and the lining of blood vessels, especially if you have a vascular graft. Now reactive arthritis is also important here in some cases, and they can typically cause eye irritation, painful urination, and painful joints. Now, what are the different risk factors that we will see? So, the increased exposure. Okay, so what is there in here? The person who is visiting from place to place very frequently, they are exposed to different conditions where sometimes the hygienic practices are good, sometimes they are not good. So because of the some poor sanitation, they can develop. So that is the one of the risk factors. Then stomach and bowel disorder. Our body has many natural defense against the salmonella infection, but sometimes the medical problem or the medication can short circuit these natural defenses, like antacid. These antacid lower your stomach's acidity, and they can allow the more salmonella bacteria to survive. Second is the inflammatory bowel disease. So this disorder damages the lining of your intestine, which makes it easier for salmonella to take hold. Third is the recent use of antibiotics. So they can also reduce the number of good bacteria in your intestine, and it can impair your ability to fight off the salmonella infection. Third risk factor is the pet or reptiles. So their sheddings will also carry the salmonella. Fourth is the immune problem. So the person with the decreased or the impaired immune system, they are also very important, and they are like AIDS, sickle cell anemia, anti-rejection drugs. So these all are the risk factor for salmonellosis. Now prevention and control. So first is the avoidance of the contamination. So firstly, because it can cause by the contaminated water, so this should be avoided. Okay, destruction of the organism. Second, if the organism is there in the food, so it should be destructed first. So that can be done by the heat or any other possible way, like pasteurization or the paying special attention to held over foods. Third is the prevention the growth of salmonella. Okay, that can be done by the adequate refrigeration and by other means. Now treatment. Coming to the treatment. Firstly, the symptomatic treatment, that is on the basis of the symptoms. Second is the antibiotic should not be used in uncomplicated cases, because antibiotic will slow down the recovery time and increase the shedding of the bacilli in feces. So if the case is not complicated, antibiotics will not be treated. Only on the basis of symptomatic treatment, the disease will go off. Now, only for the serious invasive cases, antibiotics will be needed. So this way, this is all about the treatment of the salmonellosis. Coming to the lab diagnosis, that is done by isolation of salmonella from the feces. Stool samples are the more frequently tested clinical material, and animal feces and the water source may also be tested. So this was all about the salmonella infection, that is salmonellosis.